$1.07 billion, the 2022 evaluation of generative AI in the global healthcare market. And in 10 years,
$21.74 billion is the valuation in 2032.
The numbers don't lie. Generative AI already has and will continue to transform the global healthcare market from the way we know it.
Hi, I'm John Phillips.
And I'm Emma Prada, and together we make Prada and Phillips Consulting.
And here we're tasked with showing you how you should invest in generative AI within the healthcare sector.
Today we'll start out by giving you a brief overview on what generative AI is and the global healthcare market. Then we'll take you into our ethical considerations that we made on 3 different areas within the industry, before finally making our recommendation on how to invest in the global healthcare market. And then we'll dive into our legal considerations made, as well as your investment opportunity, before finally showcasing you how your investment will impact the lives of everyday individuals.
Let's start with a broad overview of the healthcare sector. It currently makes up 18.3% of US GDP and will grow to 20% in 10 years, mainly coming from a 5.5% increase in spending on healthcare by Americans each year, and ultimately reaching the number of $7.2 trillion.
Artificial intelligence is going to have a huge impact on the $7.2 trillion in growth, but understanding AI can be a little bit tricky, so let's break it down. One type of artificial intelligence is generative AI, which utilizes machine learning models in order to create new outputs. There are 3 different types of generative AI, the first being an LLM, or large language model. Large language models act somewhat like a brain. And then there are general adversarial networks, or GANs, which are able to create novel images from combining the 2 images like shown above, the crossbreed of a zebra and a horse. And then finally, there's a variational autoencoder, or VAE, which uses encoders and decoders in order to create a unique output, which is shown in the middle.
The most well-known type of generative AI in the last 2 years has been ChatGPT. ChatGPT takes information from all over the internet, whether it be websites, books, or research articles, and boils it down to the most important parts. Then, users input a prompt and get a response, whether this be text, translate something to another language, or something like code for a software engineer. It's quite good at these novel functions, but if you use ChatGPT, you know it suffers from inconsistent and false information, bias, as well as answers you're just not looking for. And this is why we ultimately recommend you do not invest in ChatGPT anywhere within the healthcare sector.
As John had mentioned, ChatGPT derives its information from all over the internet, making its accuracy rate sitting at 20%, while domain-specific large language models have an accuracy rate of 99.7%. Not only that, but domain-specific large language models have the safeguards in place in order to protect users' data, while the GPT model simply does not. In fact, over 100,000 users had their private information leaked all over the dark web, simply because GPT did not have these safeguards in place.
When going through our ethical considerations, we identified the key stakeholders. The first being
community members,
then government authorities,
healthcare entities,
shareholders,
and finally, pharmaceutical developers.
Now, each of these are important as we've come up with 3 different AI investment options, and the first being diagnosis, the next being used for administrative tasks, and the last for drug research and development. Each of these seem like enticing investment options at first, but once you get into the nuances of the ethics for each of them, you find that some are better than others.
Imagine you walk into your doctor's office and you see a robot. If that makes you feel uncomfortable, you're not alone. In fact, 60% of patients said that they would feel uncomfortable if their medical provider relied on generative artificial intelligence within their medical care. This is simply because generative AI is extremely broad. Dr. Tor, an ENT at the University of Kansas Medical Center, said that when using generative AI in medicine, they can't trust hallucinations and we can't trust black boxes, simply because generative AI is too broad in order to make a specific diagnosis. Over 90% of doctors agree that generative AI should not be used as an autonomous diagnostic tool when in the medical industry. This is simply because doctors use intuitive nuance when diagnosing a patient.
Another use is for reducing administrative tasks. There is no doubt that physician burnout is real, with the targeted number of individuals being 124,000 by the year 2030. But those like physicians like Dr. Hitchcock, who's been running a clinical practice since 2015, see the flaws and potential for privacy leaks. Dr. Hitchcock identified that ChatGPT was quite good at its functions, but when he found out that his patients' data could be at risk, he ultimately decided to hire more individuals to work for him to reduce burnout rather than use ChatGPT to solve the problem. Whether you agree or disagree with Dr. Hitchcock, you ultimately come to learn that your investment is not the only thing at risk, but also patient privacy data.
The last option we decided to consider was utilizing generative AI within the drug research and development process. The drug R&D process is an extremely innovative sector within the healthcare industry. In fact, Dave Johnson, the Chief AI and Data Officer at Moderna, said that once Moderna was able to utilize generative AI artificial intelligence within their COVID vaccine trials, they are able to capture information and make predictions like no other. Not only that, but utilizing generative AI within the drug R&D process is going to shave down the timeline by 2 years by the year 2030. And ultimately, that is why we recommend your firm to invest in domain-specific LLMs that target drug research and development.
Now, let's go through the timeline of drug research and development. The saying time is money could not be any more applicable than in the process. In all these 5 stages, it adds up to an average process of 10 to 17 years. And by investing in just one of these stages, you could save not only time, but money as well.
There are 4 different legal considerations we made when ultimately coming up with our recommendation. The first being the AI Bill of Rights. Then we go into HIPAA compliancy laws, FDA regulations, and European Union regulations.
The first of these is the AI Bill of Rights, which was come up with the White House Office of Science and Tech Policy. Although they have not released it and it is not effective now, it could be in the future. The good thing is domain-specific LLMs are a safe and effective system, and due to the specific nature of the scientific data, there is no risk for discrimination and data privacy is protected. Also, there would have to be notice and explanation to the FDA before the product is approved because of the heavily regulated scientific process. And lastly, humans would still be a part of the drug approval process, but we would be able to cut down on the amount of humans using clinical trials with the use of AI.
HIPAA compliances were put in place in order to safeguard patient data. And given the new field of generative AI, these general policies are going to have to become more specific. But good news for us, our recommendation is able to abide by each and every one of these policies, simply because the data that is collected within the drug R&D process is non-identifying and non-specific. Therefore, we would not only be in compliance, but it would ensure that any other new HIPAA regulations that would be put in place would ensure that our regulation abides by them.
The next is FDA regulations, which in the future would use the framework that's used for medical devices. It's broken down to 3 classes. Class 1, which is low risk. On the other end is Class 3, which is high risk. Where we would fall into is Class 2, which is moderate risk, where patient life is not at risk, with some systems like diagnostic imaging systems.
Back in 2018, the European Union passed the GDPR, better known as the General Data Protection and Regulation Act, which is the toughest privacy and security act in the world. And our recommendation is able to pass this regulation. Although it is considered high risk to utilize generative AI within the drug R&D process, as long as we were to register our products within the EU database and make sure that we're abiding by the product safety legislation, we would still be able to pass the GDPR. Therefore, any rules that the federal government will be able to make, we would be abiding by them.
Next is a broad overview of the healthcare industry with generative AI. It would ultimately lead to $200 to $360 billion in cost saving and an additional $320 billion in revenue. We came up with 3 companies to invest in, and we're going to explain further.
The SWOT matrix is what we use, which goes into strengths, weaknesses, and opportunities and threats.
Our first company is Atomwise. Atomwise uses its AtomNet technology to find undruggable targets and outsource it to other companies.
Atomwise was valued at $492 to $738 million. However, one area where they fall short is that they do only target one broad area of the R&D process.
However, there's a major opportunity for potential growth as shown by Pfizer's head of AI. But the weakness is that there's growing competitors with the investment coming in. The next is Deep Genomics. Deep Genomics uses DNA and RNA technology rather than large molecular compounds.
Deep Genomics was valued at $50 million. However, they are somewhat slow when it comes to the R&D process.
However, DNA and RNA technology are improving each year as shown by the market caps. The main threat, though, is that some people do not trust this technology. Our last company is In Silico Medicine.
In Silico Medicine does a great job of showcasing the different ways that they're able to use generative AI in the process. One of their strengths is that they have a 99% cost savings from target validation to candidate hypothesis. However, they do require much human capital.
However, their doubling the approval rate will lead to additional $70 billion in valuation. But there is also a threat of multinational regulation.
Idiopathic pulmonary fibrosis, a respiratory illness that affects 207,000 Americans. One of those being Tom Frank, a 9/11 first responder. Tom explains in an interview that during his diagnosis, he not only encountered and realized that the debris and smoke encountered during these attacks is what ultimately led to not only cancer diagnosis, but IPF as well.
People.
Thank you. We're now open to questions.
All right. Ready for your questions? Here we go.
This is a three-part question. First, why is there algorithmic bias in healthcare data sets? Second, what are the potential consequences of algorithmic bias in healthcare? And third, how can fairness be established in healthcare with generative AI such as ChatGPT by utilizing the open science approach?
So most of the bias is coming from the data sets that have different patients from all over the country. Each patient is different, and you have to require specific nuances when doctors are talking to their patients to get a better recommendation. This ultimately cannot be done by a computer that's just taking in information and spitting it back out. However, Emma will explain how you can improve this.
One of the main ways that we can prove these biases is by using domain-specific large language models that specifically target and use non-identifying and non-specific data, simply because that is one of the ways that we'll be able to close in on these biases and ensure that they don't affect doctors and more specifically researchers throughout the research and development process.
The companies that we focus on use molecular compounds as the data that they're using in their products. This does not have bias in it. However, to improve it in the future for more chatbot functions, we think that you should use, to improve it better for the chatbot functions with the open science approach, we think you should use more open source models rather than closed source. This is where the code that's in the algorithm is actually present to anyone who wants to use it and can go out and find it, rather than closed source, which is behind closed doors and no one can see.
Thank you.